Hello, everyone, and welcome to the first edition of the Diabetes Care Summit. I'm Dr. Barbara Akimbua, and I'm your health buddy. This summit is for you if you've been diabetic for a while and you've been struggling with keeping your blood sugar controlled, either because you have problems knowing what to eat, when to eat, how to eat, what else you need to do to keep healthy, or you do know these things, but it's difficult to be motivated. It's also for you if you have an elderly parent who is diabetic that you care for, and you find juggling medications, clinic visits, meals, and then illnesses in between overwhelming. Or you're a beautiful married woman and all you would love to have is a normal pregnancy and delivery. And instead, you keep having miscarriages and stillbirths as a result of complications of diabetes. Or it could be your husband. He is the one who's diabetic. And during sex, you have problems. It's either most of the time he can't get it up, or he has other problems while you're having action. It's also for you if you're a health enthusiast and you believe that prevention is cheaper and better than cure. And so you'd like to learn anything you need to know to stay healthy. During this summit, you listen to loads of interviews by different specialists, including myself. Some of the interviews are short and some are not so short. But I'd encourage you to watch each video till the end because there's loads of important health information and you're getting it all for free. So, once again, welcome to the Diabetes Care Summit, and don't forget, I'm Dr. Barbara Akimbua and I'm your health buddy. See you on the healthy side. Today, we're going to be talking about what you need to know about your liver and diabetes. Sometimes patients have diabetes and liver disease, one of them could come first, either diabetes or liver disease, and it's bad enough to have one of any of them. So today I'm going to be discussing with a colleague of mine about what we need to know, what we can do, and things that can help us live healthier lives no matter what the condition is. So I'm going to let her introduce herself.
Okay, good day everyone. I'm Dr. Patience Omayi, a consultant gastroenterologist and hepatologist. I'm currently working in the Federal Medical Center, Department of Internal Medicine, Makurdi. Thank you for having me on the show.
Thank you so much, Patience. So I think we should start with understanding what the liver is. What does the liver do in our bodies?
Okay, the liver, at least it's a popular organ, at least there are different names for it in the different tribes. You know, like Amidoma in Idoma language is called Anyi. But the liver generally is the largest. In Hausa, it's Hanta.
Yeah.
I don't know, what is it in the other languages? People will pick that out.
I was trying to think and see if I knew what liver is in Tiv, and I just realized that I don't. So after this, I'm going to find out.
Okay, so at least I'm better than you. So the liver, it's the largest internal organ. When I mean internal organ within our body, so where people call the stomach, in medicine is actually the abdomen because the stomach is another different organ. But in lay language, the stomach is located to the right, just below your rib. Like I said, it's the largest internal organ. It weighs about 2 kg. It performs very many important roles. In short, without the liver, and it's just one organ, unlike the kidneys, the eyes, and other things. The liver is just one main organ. And there's nothing that happens in the body that doesn't pass through the liver. Scientists have said it performs more than 500 functions. Scientists,
wow.
But we'll narrow it down. Yeah, we'll narrow it down to the layman, which will talk about the excretory function of the liver. It helps to remove waste products from the body, like toxins and drugs that pass through the liver. Here it's eliminated, it's removed through the liver. And it has what they call synthetic function. That's synthesis means production. The liver produces many things that are important to human life. Most on the list is what they call clotting factors, immunoglobulins. All these things, clotting factors are the things that help our blood to clot when we have injury so that we don't bleed and bleed to death. The liver is responsible for that. Then it also helps to produce something they call immunoglobulins. These things are chemicals that fight infections in the body. So the liver has the ability to produce those things that fight infections in the body. It also helps to produce what they call plasma proteins that are important for other metabolisms in the body. The liver helps to break down any food at all we eat that passes through the liver. It passes through the liver and is broken down, both protein, carbohydrate, fats.
Everything.
Everything we eat. It also produces what they call bile. This bile, this greenish thing that helps, and that bile is important because it helps to break down cholesterol and other drugs too before it's excreted from the body. So basically, these are the few functions like I mentioned for now, but there are many other things. We can break them down into smaller, but as a whole, generally, those are what the liver does. It helps in fighting infections. I've mentioned that.
Yes.
Yeah.
Okay, so
it's a very important organ because there's nothing that the liver does not do.
Okay, so I'm going to ask you a few questions based on what you just said. So I'll start with the last one, which is bile. So bile is, what, when you kill a chicken, that's the way I remember it. There's a green, something like a green ball or something.
Yeah, that's like the gallbladder.
Yes, and if they'll say if you shouldn't allow it to break, if not, the contents will make the meat bitter.
Yeah.
Yes. So those contents, that's the bile.
Yeah. So the liver produces the bile from all the cells there and everything that happens there. Then it's transported from the liver into that gallbladder. It is stored there.
Okay.
So anytime they need to use it to metabolize food in the intestine now, it's now released from there, passes through those ducts, hepatic duct, and then goes down to the small intestine. Then from the small intestine now, the food that comes from your mouth that enters intestine, the bile now acts on them there. And then from there again, in medicine, there's something they call enterohepatic circulation. It moves from there. The ones that are digested now, it carries them back to the liver. And then the liver uses some from there. And then the ones it cannot even use, the liver also has a storage function. Excess carbohydrate can be stored in the liver as glycogen. So I forgot to mention that too. So that's how it happens. So that gallbladder you're trying to describe is where bile is stored. And then anytime we eat and we need to use bile to digest food, it comes out from there to act on it.
Wow, yeah. Great. Okay, so the next thing, you mentioned that all the food that we eat passes through the liver at some point during digestion. And the liver removes toxins from things so it removes toxins from food that we eat. Okay, so I'm asking this because there are a lot of things that people take. They say they are detoxifying their bodies. They will say they are taking teas or they are taking supplements or they are so what can you say about, do those things work or are they harmful? And if there's an organ in the body, which is the liver, that does this, do you need to take things like that?
Okay, so when I talk about supplements, in short, as a medical practitioner, I run away from it because when you talk about supplements, it's actually, consuming, it might be good, but those things are not well, they're not well produced to an extent, I would say, because most of those toxins can be herbs. We don't know the dose, they don't have dose. You don't know whether you are taking the therapeutic dose or the toxic dose. So you consume everything. And most of the time, for our patients that have liver problem, overworking the liver. Because now if you take the particular herb or the particular supplement, it might have some beneficial effects, but the toxic effects too. You overwork your liver by the liver trying to remove those toxins. So detoxification, you don't need, there's no such word as detoxification that you ingest. The liver has the ability to do that. A normal liver removes toxins from your body. So what people do is that they ingest wrong things and then take supplements to remove those toxins. Like you go and eat excess carbohydrate or excess fatty foods, excess alcohol, and then you say you're detoxifying. I don't understand. The liver has the ability to detoxify, and you don't need drugs to detoxify your body. To an extent, not so many people will agree with me, but as a liver specialist, it even protects your liver if you don't take those things, because you actually, most of those things have not been subjected to scientific trials. You know, they're just locally, some people stay in their house, concoct some things and tell you how. Of course, the herbs we use are good, but then the adverse effect of herbs is that we can't quantify the beneficial dose or the toxic dose. And that's why some people take herbs and then come to the hospital, even with liver failure.
Wow. Okay. So thank you for that. So we don't need to detoxify our bodies. The liver does that for us. Free of charge.
Drinking water alone. Free, yeah.
Free of, so
liver is there, the kidney is there.
So the best way to detoxify is to drink water
and eat healthy food.
Hi, have you heard of Soyo, the new diabetes care app? Studies show that the best medicine to take for diabetes is to get education about it. Because if you understand how it affects your body, you'll know better what you need to do to fight it. It will also help you to take care of someone else with diabetes. With the app, you don't just get education, you also get to make your management plan either for yourself or the person you're taking care of. There are also lots of other features like meal plans, medication, and other reminders to keep you on track. And if you fall off, don't worry, just get back on. This is how families can live healthy and happy with diabetes. Don't be left behind. Download the app at soyo.web.app to care for yourself or someone else with diabetes. How does diabetes affect the liver and the way it functions?
So diabetes is another disease entity on its own. Diabetes, usually it's a disease of sugar metabolism. Okay. The organ responsible for sugar metabolism most of the time in working with the liver too is what they call the pancreas. So diabetic patients can either have two major types, the type 1 diabetes where there is no insulin production, because insulin is produced in the pancreas and we need insulin to metabolize the glucose we eat from carbohydrates most of the time. So most of the food, even proteins, are broken down to glucose, and glucose is the one that insulin acts on most of the time. So the type 1 diabetes, they're not producing insulin at all. Type 2 diabetes, they're producing insulin, but it's not enough and it's not acting well. So the liver and diabetes are related. Take, for instance, there is a disease condition that affects the liver. They call it hepatitis C. When you acquire hepatitis C infection, it's enough to cause problems in your pancreas. Hepatitis C, aside from affecting the liver, also affects the pancreas. And causes destruction of those cells in the pancreas, that produces insulin. So in short, studies have shown that more than 50% of people who have diabetes, you should go back and check their hepatitis C. And even in Benue, where I work, I've noticed anybody, any diabetic patient you see, you must check hepatitis C. It's a rule of thumb.
Right. So from what you are saying, for some people, they get diabetes after they acquire hepatitis C infection because the hepatitis C virus has damaged their pancreas.
Correct. Yeah, very right. Yeah. And in those people, if you treat the hepatitis C, their diabetes actually go. I had a patient I managed like that. And it was like a miracle for her because hepatitis C didn't manifest in her, but she kept having diabetes, problems of diabetes. So the day we discovered hepatitis C, she was already like already having problems with the liver then. But you can imagine if the hepatitis was tested earlier and treated, she wouldn't have been coming down with, yeah. So some people, if you treat their hepatitis C early, the diabetes disappear. That's one pathway. Then the second pathway, how diabetes can affect the liver. We know that in diabetes, when sugar is not metabolized, the sugar can accumulate and be stored as glycogen. And when we now try to break down the glycogen, one of the products that come out from it is cholesterol and fatty acids and cholesterol. So in patients with diabetes, especially when they are not properly controlled, that can happen and they coexist. And so those patients now have very high cholesterol level. And those cholesterol level, if they are not removed properly from the body, they accumulate in the liver and they can deposit in the liver as fat. That's another part. Then another pathway again is that most of the patients that have diabetes naturally are obese. You agree with me? Especially type 2 diabetes. Yes. A lot of them. Yeah. So this diabetes, this obesity too, does not only present with diabetes as a complication, the fat deposit, because obesity in layman language is just fat accumulation, fat deposition in abnormal places, your stomach and other places. Yeah, so those fats, when they accumulate in those stomach and other places, they also accumulate in the liver, and directly the obesity, diabetes, cholesterol issue can also cause fatty liver for you. That's liver disease occurring in that. So at least 3 parts I've mentioned now: the hepatitis C, the diabetes, and
bile and
like with glucose metabolism, yes. Yeah, and then the cholesterol pathway. Those are the 3 major pathways where diabetes can cause a liver disease.
Okay, so patients with diabetes, especially if it's not well controlled, can eventually get liver disease because
yes,
the glycogen, when it is broken down, and because it is excess, it is converted to cholesterol and other fatty acids, which affect the liver. And then if they are obese from whatever cause, the deposition of fat in the liver too affects the liver and will eventually lead to fatty liver. Wow. So what can patients do? You've already told us about hepatitis C. So how often should patients or people screen for hepatitis C infection?
Okay, so like screening for hepatitis C should be offered to everybody. People who pre-employment, healthcare workers, marriage counseling, and like I mentioned, every diabetic patient should have a hepatitis C screening done. Yeah, so very important.
That is to prevent diabetes caused from hepatitis C. So now for patients,
you'll be killing 2 birds with one stone. You'll be treating the,
Okay, so for patients who have diabetes, what can they do to prevent developing a fatty liver? Because I'm guessing that if they develop a fatty, it makes things worse.
Yeah. So patients, fatty liver disease, in short, by introduction, I should have talked about it. It's just, when you say fatty liver, it's a liver disease that results from accumulation of fat in the liver. It's non-alcohol related. So say fatty liver, if you say fatty liver, everybody will assume there's non-alcoholic fatty liver, because there's actually a disease entity called alcoholic fatty liver, but those ones will occur in alcoholic. So when we talk about fatty liver, I assume it's non-alcoholic fatty liver.
Yes, yes.
Okay. Yeah. So patients with diabetes should have their screening done. And when the screenings are done, they must be enrolled with a healthcare professional who has the capacity to manage diabetes. Diabetes is a lifelong disease, except for the secondary causes of diabetes. For instance, hepatitis C can cause secondary diabetes, while when you treat it, you cure it and the person can go. If not, the normal classical type 1, type 2 diabetes, it's lifelong. So when you see a patient from the beginning, you have to educate the patient. There's no cure for this diabetes. We are going to manage it. Managing means you will be euglycemic. You have a normal blood glucose level, and that's what we need, because without normal blood glucose level, we are sure there will be no complications, and then you can live your normal life. Yeah. So we ensure that is done. Then patient has the normal screening dose, because diabetes can affect virtually every part of the body. And that's why we don't look forward to the complications of diabetes, from the eyes to the brain to the liver to every part. So those patients should have their baseline investigations done. Check your kidneys, check your liver. And if there is anything, if there's diabetes coexisting with cholesterol, dyslipidemia, you will treat the two. If a diabetic patient is obese, you will tell them about weight loss. If a diabetic patient has hypertension, because diabetes coexisting with hypertension is also very dangerous, they will also take care of that. And then you monitor them, stabilize them, make sure they're on a surveillance program, and they come regularly for their clinics. I don't know if I've been able to answer that question.
Oh, you have, you have. So they need to,
Yeah.
from what you've said, they need to access care from a specialist that can manage
Yeah.
diabetes, not just anybody.
Yeah.
They need to be
Yes.
going for regular clinic visits or appointments so that they'll be checked. They need to manage other conditions if they are there, like hypertension. And they need to keep going to clinics so that they prevent them from getting other problems with diabetes affecting other organs. Okay.
Yeah.
So,
In short, there is a catch there somewhere. Sometimes people tell you, I used to be diabetic, but now I'm not taking drugs anymore. My sugar has become normal. In short, those kind of patients, you draw them closer because they are heading towards diabetic kidney disease. So if a diabetic, all of a sudden, the diabetes disappear and they are telling you, no, they are cured now. Those kind of diabetes, you should watch that, because what it means is that the little insulin they have is accumulating and then controlling the sugar for them, because their kidneys are not even excreting
functioning well.
those things well. Yeah, so there's no.
How? We learn every day. So you mentioned hepatitis C, but a lot of the time people talk about hepatitis B. There is hepatitis B vaccination, there's hepatitis C screening. I remember some years back, it was like a movement. People in Makurdi used to take themselves in buses going to Jos. Yes, that they were going for some specialist treatments for hepatitis B. So what is hepatitis B? Can patients with does hepatitis B infection cause diabetes? Does it affect diabetes? Can you educate us about hepatitis B infection and diabetes?
Okay, so let me start from the Makurdi story. In short, since my practice in Makurdi, I'm very wary about the patients who have been to Jos for treatment before. I did my residency training in Jos, and I have a lot to say about that. Okay. When they come to the clinic here in Makurdi, they tell you, they've been to Jos in 2008, 2009. Most of those patients who are telling you, I'm describing for you now, either liver cirrhotic patients or hepatocellular cancer. Most of the clients and patients I've managed in Makurdi are patients who have assessed that hepatitis care in Jos. It's very unfortunate because it was destruction. Jos is a center, an excellent center for treatment of liver disease. When you talk about the teaching hospital in Jos, they have a full-fledged hepatology unit that have people assessed from the North Central geopolitical zone. But the man who Benue people were coming to meet there was not a doctor. So most of the time when I tell them, when you go to that place, does it look like a hospital? They tell you no. So, but the man just did rubbish. He wasn't treating them, and I'm sorry. And I use this to campaign that if you live in Benue and you went to Jos for that treatment, please come again, let's check you. You know, because most of them went with the limbo of they've been cured from hepatitis, and they just go and sit at home and boom, one day they come down with liver cancer. It's so pathetic. So back to the question, hepatitis B. I'm very passionate about it because of it affects a lot of people, especially in Benue here. We've not been able to unravel the cause, but like HIV, nobody's interested in the cause right now because it has actually spread. And what we should do now is prevention. So hepatitis B is one of the viral hepatitis that affects the liver. When I say it's hepatitis because it has predilection for the liver. People talk more of hepatitis B and hepatitis C because they are the ones that have the probability to progress to chronic liver disease. What I mean is liver cirrhosis and liver cancer. Other hepatitis we have is A, we have A, B, C, D, E.
Yeah.
But the A, D, and E, we are not so worried about. D can occur only if there is B. So they have to be B for you to have hepatitis D. Hepatitis A and E, they are not dangerous. We can, in short, without treatment, people recover. You know, just like acute, those ones are acute, they don't progress. So people don't talk much about that. So people should avoid saying, they have, in short, we don't even test for it. In Benue right now, we are not testing for hepatitis A and E. People might have it, but just passes like normal flu, like gastroenteritis illness. And so back to hepatitis B. It causes liver cirrhosis and liver cancer. That's why we make a lot of noise about it. Hepatitis B is preventable. That's why we make a lot of noise about it. So because it's preventable, people should not be coming down with hepatitis B infection.
Or
when hepatitis
liver
B,
cancer or liver cirrhosis from hepatitis
B. Exactly. So when hepatitis B affects the liver, it causes destruction, damage to the liver cells. And because it damages the liver cells, it affects the normal functioning of the liver. So all those things that I talked about, your liver might not be able to excrete bile, it will accumulate. Then it will now even cause jaundice for you. It might not be able to produce clotting factors. You start bleeding. You know, you might not be able to metabolize most of those nutrients that you need. And so you start losing weight. You know, albumin that is produced from the liver that helps to maintain water balance between, I don't know how to describe that now, between inside of the body and inside the vessel and outside the body is not produced. So you start having fluid accumulating in other places where they're not supposed to be fluid. And that's why you start having stomach swelling in hepatitis. So when that happens, but majority of the cases, you might even have the hepatitis and not know that you have it until you start presenting. So most of the times, it's even asymptomatic, no clinical features, you be living your normal life, and then one day, it just comes down with complications. So it is advised that people have regular checkups, especially, there's nothing wrong with you going to a standard hospital, a standard lab and say you want to be tested. I use the word standard because they are also very, I don't know the word to describe it. Yeah, around in Benue right now, that somebody will have hepatitis, they will test and they'll tell you that it's negative, and the person goes to sleep. All of a sudden, the person comes one day and tell you that they are having complications of hepatitis. So, how does one get hepatitis B? We talk about the vertical.
Both hepatitis B and C. How do people get them?
Yeah. Okay, so it's almost the same, just for a few differences. Hepatitis B, why is even very painful hepatitis B is that hepatitis B, you can have it today, it might not cause any problem. Tomorrow, you're having liver cancer without any notice. So it can happen like that. So they call it de novo. It will just, today is there, tomorrow is not there. Then hepatitis C, the good thing with hepatitis C is that hepatitis C gives you time. Hepatitis C will progress for a long time, become cirrhosis, because it will become cancer. But hepatitis B can jump from normal hepatitis today to liver cancer without passing through cirrhosis. And that's why we don't joke about if somebody has hepatitis B. So mode of transmission for the both of them is almost same. We talk about the vertical mode of transmission and the horizontal mode of transmission. Vertical means the person gets it directly from the mother. So from infected mother to their unborn child. I think in Benue, that's the commonest, from just anecdotal studies. I think that's the commonest way of transmission, because a lot of pregnant women come, they are pregnant, they don't even know they have hepatitis, or they are diagnosing their hepatitis maybe a few weeks to delivery, when you don't even have the ability to screen them, you know, and then they're going to deliver, maybe not even in the hospital. Transmission occurs from mother to child directly at that point in time. That's the vertical transmission. Then the horizontal transmission, we talk about from not only from mother to child, fathers too also can transmit to their children. So So when I give lectures, all they say is more. I say, no, it's not only mothers, even fathers. So horizontal transmission, if an infected father carries the child to Baba, they share the same paper and all that. In short, hepatitis B is 100 times more infectious than HIV. So when you keep HIV, the person will not get infected. Hepatitis, 100 times.
It will transmit.
Yeah.
So
Yeah,
can a father transmit by, can it be transmitted by contact? Can it be that, so skin to skin contact? Can it be transmitted? So how does a father?
So there have to be a breach. There have to be a breach in the skin. Yeah, so there have to be blood contact, but no matter how small the blood contact, it can be significant. And that's why we talk about if somebody has a cut, even children to children, that's even the most, another route of transmission. Children who play with children in the schools. So an infected child, just by scratch marks that you might not even see, is enough to transmit. So there's a small cut here, you might not even be visible, but if there's a contact at the breach in mucosa, it's enough to transmit it. But just intact skin to skin, no. So you can actually sleep on the same bed with the person who has hepatitis B, and you won't contact it. So people talk about saliva, kissing, unless there is actually blood in the saliva and then there's a break in the other person's mouth too. That's when it can. So you can share cutleries. It's not enough because you don't bite the cutlery or you don't put blood on the cutlery when you wash cutleries before you use anyway.
Oh, yes.
So those have been, there's people talk about mosquito. No, it's not transmitted through mosquitoes.
Okay. Mosquitoes don't carry it.
So as healthcare professionals, how it affects us.
One question before you go to health. Can a husband give it to the wife during sex?
Yes. Okay. So I was going to come to that. Sexual intercourse, yeah.
Okay.
So actually, so an infected, or any of the partners in short, whether the man or the woman. Yeah. So if they can, because sometimes during sexual intercourse, there can be trauma, you can't rule it out. So an infected partner can transmit it the other way. But then I'll follow it up with a statement and say, that's not a reason for some churches in quotes to say people that have hepatitis should not marry. I've seen such cases a lot in Makurdi, and people are coming to meet me. But thank God I've been able to speak to some pastors and even counsel the partners involved, and there's a problem. So if a partner has and the other partner doesn't have, it's simple. The partner that has is evaluated for treatment. The partner that is negative goes for vaccination, and that's fine. So the both of them can marry and even have negative children. And if the negative partner is the wife, then she can even have children without hepatitis. If she's vaccinated, she has sexual intercourse, gets pregnant, and she won't come down with it if she actually, and even for the man, if he's on treatment and his viral load is suppressed, he can not transmit it to the wife, and then they can still have children. Yeah.
So there's a vaccination for hepatitis B, and both adults and children can access it. Yes. Is there vaccination for hepatitis C?
No. Because if you know how the viruses that there's never going to be vaccination for hepatitis C.
Okay. Yeah. So
so other modes of transmission, let me just finish on that. Transfusion of on-screen blood. Yeah. So I'm surprised some villages within Benue too, and even in other parts of these low resource countries, there is this transfusion. You see the way blood is transfused. They don't even screen it at all. They just collect and then transfuse, which is not good because you can actually transmit hepatitis B. Then sharing of sharp objects. I learned that some places still sterilize needles for injection. It's a bad practice. So sharp objects. Then there are some patients, IV drug users, and especially for patients with hepatitis C. People give themselves drugs, they are high. That's another way of transmitting it. Then blood products, organ donation. And there are some illnesses that put you at risk of blood transfusion. For instance, sickle cell anemia, they are prone to recurrent blood transfusion. So those people are also at risk group for getting hepatitis. Then healthcare workers, especially those that work in the lab, increase, even surgeons. I tried to do a study in the hospital recently, last year during the hepatitis screening, but the data is still being tidied up.
Okay.
So a lot of healthcare professionals are at risk of getting viral hepatitis
Okay,
because of their
so
exposure to sharks.
hepatitis B can be prevented with a vaccine. How can
Mhm.
hepatitis C be prevented? Just screening and
Yeah,
treatment.
screening and treatment. Yeah. So anyone who has it should be treated. And there's a good news actually. When we come, the hepatitis C is curable. So you
Great.
don't have hepatitis C
Great.
forever. Yeah. So
Great.
in as much as it does not
So,
have vaccine, it is curable.
so we shouldn't be afraid to screen for it because it can be treated and cured.
Yeah.
Okay.
Yeah.
All right.
Especially when it has not affected the liver. So you go, you do your hepatitis test. If you are positive, you look for a specialist, then do other follow-up tests for you, and then you assess treatment if you qualify for treatment. Treatment for hepatitis C, 3 months, 6 months, you are fine.
You are good to go.
However, if you are good to go. However, if you now allow the hepatitis C to become cirrhosis before coming for treatment, that is where the problem is. Because even after treatment, you will need to be followed up for the rest of your life to prevent liver cancer. Because cirrhosis is what they call pre-malignant. Yeah, so if you have cirrhosis, it can become a liver cancer. So that's why we should never wait for it to become cirrhosis before coming for treatment. If it's normal hepatitis C, you come, they evaluate you, do your viral load. If your viral load is within treatment range, they offer you treatment 3 months, 6 months, and you are good. But because of the economic situations at home, you see patients. In short, I have a long list of patients in clinic, hepatitis C, they can't even access viral load. Talk more of treatment. Even when they do viral load, you tell them this is the cost. You don't see them again, and we are hoping that one day government will do something to help us.
We'll get there. We'll get
Yeah.
there.
So
So,
for hepatitis B, we'll continue with that. Hepatitis B, not all patients with hepatitis B will be treated. Not all. So the problem is, if you have hepatitis B first, you need to be enrolled in a specialist care, because you might not qualify for treatment today. You will have to be doing regular checks to know when you become eligible for treatment. You might be lucky your body might clear the infection one day, but how do we know your body will clear the infection? It's by that follow-up surveillance. Every 3 months, 6 months, there are tests we let you do. And I tell people it's not good enough for you to just do liver function test and go, because liver function test is just one function of the liver. So like I said, there are other things that will check in the liver before we can say, okay, go, you don't need treatment for now, come back in 3 months, come back in 6 months. Okay, at this point in time, you qualify for treatment now, and then it's offered. Sometimes they come and we don't have to treat them. After so many years, they live with it and nothing happens. But then that surveillance is important for hepatitis B. However, those that qualify for treatment for hepatitis B, treatment for now is for the rest of your life. So if they start you on treatment for hepatitis B, you will have to be on it for a very long time.
of your life. I'm
For
happy.
now, maybe, but
Okay.
studies are ongoing and we are hopeful that someday they'll bring treatment that will just be for a short duration, and I'm sure that will be the next breakthrough for the next century.
Good. I'm happy that you mentioned liver function tests and the fact that it is not the be all and end all in assessing the liver, because a lot of the time people just feel I've done my liver function test, is normal, so everything is okay. And there are more tests, there are other tests that the specialist will give you to do to check that you. So don't go to sleep because you've done a liver function test. So alcohol, liver, and
Mhm.
diabetes in our environment, there's a high rate of alcohol consumption.
Yeah.
And in
So
fact,
sad.
the breweries in Nigeria make lots of money because of the level of consumption. So how does alcohol affect the liver? How does alcohol affect diabetes? How are the three related? Alcohol, liver, diabetes.
Okay. In short, the three you just mentioned, but there are three evils, and the three should never be together. As a matter of fact, my patients with liver disease, the first thing I tell them, stop alcohol. And they say, doctor, how can I say so? That is for me to tell you, it's for you to do. You know, thank God it's
Wow.
adult medicine school. Yeah, it's for me to tell you because alcohol has a direct toxic effect on the liver. In short, when we were in school, they used to tell us, carry a liver tissue, put alcohol on it and see if there will be a change or not. And that's what happens when you take alcohol directly. In short, alcohol on its own causes liver disease. It causes hepatitis, it causes liver cirrhosis, it causes liver cancer. Then you're now having alcohol with hepatitis B. There's a synergistic effect. Let's say it's going to take you 5 years to develop cirrhosis. If you are taking alcohol and you have hepatitis B, in short, is 6 months. So
Wow.
yeah, it has a synergistic effect, and that's one of another big problem we have in Benue. The incidence of liver disease in our environment is very high, and I think it's because of this synergistic effect of alcohol and then viral hepatitis. Then bringing diabetes to it, alcohol affects the pancreas directly. So if you have diabetes already, your pancreas is producing small, then you now take alcohol on it, you are shutting it completely. Then the diabetes that affect both pancreas and the liver, you are shutting the pancreas, you are shutting the liver. So in short, the three, it's a no-no area. Alcohol should not be consumed by people who have diabetes or liver disease
Or both.
because, yeah, or both, because of the synergistic effect. The three of them have synergistic effects. Alcohol will cause obesity. Obesity will worsen your diabetes. Alcohol. So there is just a twin that is just tangled that you can't even untie.
You're pouring petrol into, not kerosene now, you're just pouring petrol
Petrol
into
into
the fire.
fire. Yeah.
Yes. So I'm asking this for the patients, is there a safe limit for alcohol for anybody with diabetes or for anybody with diabetes and liver disease?
Yeah. So some of the patients will even tell you that a little alcohol is good for the liver, and I tell them, or for the heart. I tell them the kind of alcohol they even talk about is red wine. And the red wine is not the alcohol itself that is beneficial in red wine, it's the flavors in the red wine. So alcohol really does not have beneficial effect in patients that have liver disease or diabetes. No beneficial effect. However, and I don't want people to hold me to this statement I'm going to make, there's what I call significant alcohol consumption. And it's the significance of the alcohol consumption that we talk about when we talk about alcohol and liver or alcohol and other disease condition. There are limits for various disease conditions, for the heart, for the liver, even for diabetes. But in general, they tell you a man should not consume more than 21 units a week. The 21 units is equivalent to one bottle of beer a day. Less than, because that's even an Oyibo value. So you see the Oyibo bottle of alcohol is smaller than the ones we
Smaller
have
than
here. It's 2 times, almost 2 times the what we have here, you know. So if you can drink half a bottle of beer a day and you're okay, fine, it's safe for you. Yeah, it's fine. But how many people open a bottle? You sure they don't take one bottle, they take 3 to 4 before they know they are. So if you can take half a bottle, not up to one
every
bottle,
day.
Nigerian alcohol, it's okay, it's safe. For a man, a woman, less than half a bottle of alcohol. Yeah, so for a man, it's 21 units. For a woman, it's 14 units, less than. So I've done a conversion for you already. For a woman, less than half a bottle. For a man, half a bottle, not up to a full bottle of alcohol a day. It's okay. So if you are taking large quantity every day, you will be consuming less than 21 units in a week. And the catch is that don't say, okay, I'll drink today, I won't drink tomorrow, and then take everything in one day. That is called binge. That's even another different area we don't want to go to, because that one is acute liver failure you will have first before to start accumulating. So, and then alcoholic binge, you can be predisposed to vomiting blood and all those other things that come with it. So there is no way around it. Stop is stop. Stop alcohol, stop smoking.
Okay, so what about red wine? Because some people will
What?
say because red wine, they believe red wine is healthy, they can go to
Mm,
town with that, they will drink lots of
mm,
that and stop drinking. So
mm.
what is the safe limit for red wine?
So the red wine, like I said, the alcohol content in red wine is even more than the one in beer bottle.
Yeah.
Because in most beer bottle you have 5%, but in red wine you have 11%. So if you are taking maybe 300 mils of beer and you are taking less than maybe 50 mils of red wine, it's almost the same quantity of alcohol you're consuming, 50 to 100 mils. So it's almost the same quantity because if you multiply 5% by
Yeah, yeah.
that. So I tell people if you must take a red wine, just maybe half a glass, less than 250 mils, maybe 100 mils,
Wow.
which most
Wow.
people won't even take. Ehen.
Wow.
So, but most of the time,
That
people
is,
go out and tell you they're finishing a whole bottle, two
oh
bottles of
yes.
red wine, three bottles. That's a lot.
Yes. So,
And it's not the alcohol that is beneficial in red wine, no. It's the
mm-hmm,
flavonoids.
mm-hmm, mm-hmm.
Mhm. Then whiskey, in short, by the time you are taking 20 mils of whiskey, it's like a bottle or two bottles of alcohol.
That is a shot of whiskey.
Yes, yes. There's a, maybe I'll share it with you. There's a document that approximates this to this to
Okay.
this.
Okay. All right.
Yeah.
Wow, we've discussed a lot and it's been very interesting. So, if there was any advice you give anyone with diabetes and liver disease, what would it be?
Okay. That if you have diabetes and a liver disease, there are two evils that you should manage because they can actually cause grave complications. However, if you have diabetes and you have a liver disease, first and foremost, you should be enrolled and eligible for treatment. For diabetes, you should be enrolled to see a specialist who will do baseline investigations for you to commence you on treatment. And while you're on treatment, you need to be followed up to see whether the drugs you are taking is even working, and then you continue that follow-up, take your drugs properly. While taking the drugs too, you need to exercise. If you have obesity, you need to lose weight. You need to modify your diet, eat lots of vegetable, reduce your fat content. And if you are diabetic or if you have a liver disease and you also have cholesterol issues, that's lipid issues, you should be treated because there are two different drugs. You treat the diabetes, you treat the cholesterol, and then you also, together with the liver disease, if you qualify for treatment for liver disease, be it hepatitis B, hepatitis C, or even fatty liver, there are drug treatments for fatty liver aside the ancillary ones we do. So you will have ultrasound done. You will also be evaluated in that line. And then with that, I think you'll be good to go. You will not fear the complications that come, and you'll be able to live a very normal life free of complications.
Thank you so very much, Patience. So you heard it all. Diabetes is not a death sentence. And even if you have a liver disease or you have hepatitis, any of it, there are solutions that are available. We've learned a lot. We've learned about how when you were talking about hepatitis C and diabetes, what came to my mind was this proverb that there are different roads to get to a destination. And even with disease, it seems that there are different routes by which you can get it. But just the same way there are different routes to get the disease, there are so many other different routes for management and for living a healthy life. So living a healthy life is possible. All we have to do is find out what we need to know and what we need to do. So thank you once again, Dr. Patience. Thank you, thank you. I've learned a lot. I'm sure the listeners too have learned so much. I'm glad you took my advice and watched the video till the end, and I hope you learned a thing or two. So don't forget, watch the next videos because there's still lots of information that will be really beneficial to you. Don't forget soil.web.app. Download it now. See you in the next video. Bye.